Do you know the story of Dr. Hammer, Dr. Reich Geert Hammer? Do you know his story? If you don't, you need to know it. I first came across his story in 2017 and it blew my mind and changed absolutely everything I thought I knew about health, about disease, about sickness, about cancer. It changes everything. Okay, so Dr. Hammer, in 1978, his 17-year-old son went on a trip. And while he was on this trip, he was sleeping on a boat one morning, and the Crown Prince of Italy went crazy and shot a gun, and the bullet went through the side of the boat and hit Dirk Hammer, the 17-year-old son of the German medical doctor, Dr. Reich Geert Hammer. And from that point, there was drama. There was getting him to the hospital. He had dozens of surgeries. He had his leg amputated. And tragically, he passed in his father's arms. And then a couple months after that, Dr. Hammer developed testicular cancer. And he had an inkling that there was a connection between the loss of his son and the development of his cancer. And he had the chance to test this theory when he was working in Bavaria in an oncology ward with cancer patients, where he was able to ask these people who had been diagnosed with cancer, did you have something shocking happen to you prior to your diagnosis? And 100% of the cases, the resounding answer was yes, there was something shocking and tragic that happened to me in my life prior to my cancer diagnosis. And beyond that, he noticed a pattern that depending on the type of cancer, there was a specific type of emotional shock that the person experienced. So for him, he had testicular cancer and had the loss of his son. And when he spoke to other men with testicular cancer, they all suffered some type of tragic loss. Or women with the ovaries, which are the female correlate to the testicles, all the women who had ovarian cancer had a traumatic loss experience. Every woman who had glandular breast cancer had some type of worry in her home, worry for a loved one. Everyone with lung cancer had a death fright shock. Everyone with colon cancer had an ugly, indigestible situation in their life. And so this pattern started to emerge, and he had dreams. His son came to him in these dreams, and he was feeling the sense of, am I putting these pieces together? Am I actually understanding the reason that cancer develops in the body? And it came to him that this isn't a mistake. Can you see the biological purpose? That's what Dr. Hammer's map gives us, is the understanding of the biological purpose behind what we thought was disease, was mistake, was the body screwing up and just replicating cells out of control. That's what we've been told that cancer is. But what Dr. Hammer discovered is that every cancer shows up in a particular organ and it has a particular purpose. Think about his experience. If you lose a child, your offspring is gone. What would how could your biology help and assist you through that very traumatic loss situation? Well, by proliferating additional tissue in the organ that allows you to reproduce, right? More tissue in the testicles would allow for greater reproduction. More glandular tissue in the breast that produces breast milk. If you have a worry, if you're very worried about your loved one, wouldn't it make sense that your body has this nourishment that it can provide? And so he started to see that every organ has this ability to go into this adaptive mode where it can grow extra tissues or erode tissues or change functionality. Your body is basically a transformer, and it can transform itself to better adapt to the upsetting, shocking situations that life sometimes presents us with. He took it a step further where he says, okay, so there's something going on in the physical tissues and organs in these people's bodies, and there's something that happened in their emotions, something happened to them that they experienced. He said there has to be something in the brain, because how else would the information be transmitted to the body? So he started looking at CT brain scans, and on this brain scan, he saw specific circles in specific regions of the brain where he could tell, oh, when there is a circle in this part of the brain here, that tells us that there's going to be a cancer in this part of the body. And it was correlated 100% of the time. Every time he looked on the CT brain scan and saw a circle in that particular area, so in this case, this example I showed you here was for the mammary glands in the cerebellum. So every time he saw a circle in the cerebellum, there would 100% of the time would be a adaptation on the organ level. And also, if you talk to the person, there would be an experience that they went through that correlates to that brain area and to that organ. And this map, he was meticulous, and he only put things in this system, in this chart behind me, if he could prove it 100% of the time, with no exceptions. And so what he developed is this map of 5 biological laws for understanding how the body works. And it is criminal that not every doctor, not every person is aware of this map. And so that's why since 2017, I've been here singing this song and shouting to the world, hey, look into the 5 biological laws of German New Medicine, also known as Germanische Heilkunde, or the Germanic healing knowledge. So if this is your first time hearing about it, congratulations, jump down this rabbit hole.